So welcome everybody to our very first DFCR webinar. We'll be doing these quarterly for members and anybody who would like to join us. So thank you for joining us. Okay, so you all here obviously know about DFCR, but I just wanted to say a little bit. I don't know how much you know about it. So DFCR serves as a global voice for physicians and other health professionals to advance the legalization and science-based regulation of cannabis. Through education and advocacy, we leverage the influence and expertise of the medical community to realize the legislative changes necessary to promote improved public health, social justice, and consumer protections. And I don't know if you know the history, but it was started in 2015 by David Nathan, who is going to be talking today. And let me tell you a little bit about David. I've told you about how he started DFCR, but David is a psychiatrist, writer, and educator in Princeton, New Jersey. He served as our first president, obviously. He is Distinguished Fellow of the American Psychiatric Association and Clinical Associate Professor of Psychiatry at Rutgers Robert Wood Johnson Medical School. While maintaining a full-time private practice, he serves as Director of Continuing Medical Education for Princeton's healthcare system, and he's Director of Professional Education at Princeton House Behavioral Health. He's done a lot of interesting things. He's published a lot of very interesting things that you can look up on Wikipedia that have nothing to do with anything that we know David for. So he's interested in a lot of very interesting and arcane areas. So, David, I'll turn it over to you.
Thank you so much for that introduction, Brian. A couple points. One is just whenever we mention my home institution of Penn Medicine, Princeton Health, and its psychiatric hospital, Princeton House, I always want to hastily add that I don't represent the views of my hospital on this issue. They've been very kind to me in terms of letting me do my advocacy, but they, appropriately want me to just make sure that's clear. And Brian didn't talk too much about himself, but suffice to say that from about the second or third year of DFCR, I've been saying that as soon as we get someone who is a real leader and manager of people who can take the organization to the next level, I'll step aside, which early on sounded kind of odd because, it's still a fairly new organization. So, how is it going to survive without me? Well, thank goodness we had Brian come on the board, and he then became the executive vice president, essentially running DFCR while I was kind of head of state. He was head of government, if you will. And last year, I could see that it's time. We need him at the ship's wheel to steer it. And he is really, truly turning this into a next level nonprofit. I'm very big into ideas and building things, as I'll be talking about today. But to have people like Brian to kind of herd the cats and get us all rowing in the same direction, to mix metaphors, has been a wonderful thing. He's proved himself at the VA hospital and is editor-in-chief of one of the major addictions journals. And so, of course, I'm very grateful that we have him. So I think some of you may have seen this map, and I don't mean the United States, I mean the legality of cannabis. This is straight from Wikipedia. I appreciate that they do this because it's very hard to keep it updated. More and more states keep turning blue. Some of the gray states have turned green, but I think not in the not so distant future, the entire nation will be blue with questions of how we conduct sales and so forth. And that's very much in line with how alcohol prohibition was ended in 1933. Some states like Kansas didn't start actually allowing sales of alcohol for decades following the end of prohibition. And that may be the case here. And if that is the will of the states, that makes sense. But of course, we really want to end the criminalization. And if we're going to end the criminalization, then we better have good regulations in place. People ask, should we do it like alcohol and tobacco? And the answer is absolutely not. We need to do way better than we did with alcohol and tobacco. And I think it's very much in the interests of the cannabis industry to support this endeavor, to get good regulation, because it'll get us started on the right foot and will honor the needs of public health and public safety. And so that brings us to kind of the sweet spot of regulation of, well, all drugs in a sense. And here you can see that alcohol and tobacco, we have a lot of commercial promotion, maybe not enough regulation. And so we need to push in the direction of more stringent regulation. And with cannabis, we were, of course, around full prohibition. And now the arrow is directing more toward that middle. And in this middle is where you have minimized social and health harms. So for me, one of my great passions is cannabis labeling. Why? Because to me, it's a keystone holding up the arch of cannabis regulation. It's the convergence of several processes, including testing and public safety and consumer protections and the ability to track the cannabis from seed to sale. Right now, it's all being done at the state level. States have widely divergent regulations on labeling, as you'll see from the main discussion of the symbol. And at some point, we're going to have federal oversight. And in order to have that, we need to start building some consensus on what we think good labeling should look like. So this is the project I undertook a couple of years ago. And as a board member of DFCR, I'm really focused on now. There are really three components I'm going to talk about today. One is the cannabis product symbol, and that's kind of fun because it's really gotten legs. And it's been a very exciting, well, actually few weeks, but also a few months. And the past year has really been building up quite nicely to where we are now as far as the adoption of the cannabis symbol. Second, we have package warnings. And for those of you out there who want to get involved, this is still the ground floor on this project. I have a proposal for what standardized package warnings could look like. And if you guys want to get involved, please feel free. Just reach out to me. My email will be at the end of the slide deck. And then finally, cannabis information label. That is the highest level of complexity of all of these areas. And what is going to end up as the eventual standard is something we don't even know yet. You know, there's no way we can really account for everything that will be required at the federal level with so many different shareholders and competing interests feeding into this question. So the symbol is just a symbol. It is what it is. The package warnings are somewhat mutable, but it's fairly condensed and concise. And finally, the information label is got a lot of information on it, as you'll see, and that's something that will be a work in progress over the next years. So if some of you don't know what voluntary consensus standards are, at least you don't know the term, you do know what they are, because those are the regulations that decide how much space should be between uprights in a staircase so the kids don't get their heads stuck in them. It's all of those specifications that have been developed by a collaboration of industry, the public sector, government, regulators, the public at large, consumers. And when everybody comes together and says, okay, we need good regulation because in order for this to be a reputable industry, we need to regulate ourselves. And when those consensus standards are devised, then it makes it easier for authorities having jurisdiction, states, nations, to adopt the standards, or at least, you know, modify them slightly, but use the spirit of what's been developed. Organizations that you've probably heard of, ISO, is probably the largest in the world. There's ANSI, And these acronyms often used to stand for something like ASTM was the American Society of Testing and Materials or something like that. They started out in the late 1800s dealing with metals and making sure that iron was up to snuff if it was going to be used in bridges, for example. And National Conference on Weights and Measures. All four of those organizations are relevant to the symbol that I'm going to discuss today, and they will all have a hand in cannabis regulation generally. The significance of using voluntary consensus standards cannot be overstated. The National Technology Transfer and Advancement Act, NTTAA, was passed over 25 years ago, and it actually requires the federal government to use these voluntary consensus standards when they're available and unless there's a compelling reason to do otherwise. And actually, if they choose not to use an existing standard, they actually have to submit reports to some federal agency that oversees this to explain why they're not using consensus standards when those are generally considered the gold standard of practice. And of course, we've always considered this best practice, but now it actually obligates the federal government, and that's not a bad thing. So ASTM is one of the organizations that I've already mentioned. DFCR and ASTM has gotten together, and this is where we're getting the first true universal standards for labeling that weren't simply state by state. So ASTM is a very large organization. It's not even the biggest of the voluntary consensus standard organizations, yet it's large, it's highly influential, and it's actually quite well run, I'll add, as a member, having worked with them now for a year and a half. I'm pretty impressed with how they make sure to keep up the high standards and requirements that help them maintain their reputation as a leader in consensus standards. So the committee that deals with cannabis is called D37, and that committee has over 1,000 members in many countries, and they've published a bunch of standards. And this new symbol standard that was approved within the last month may prove to be the most widely known within a few months, because they're not just with DFCR, but ASTM is launching a publicity campaign to promote the use of the symbol. So how did we come up with the symbol? It really is quite straightforward. So here we are talking about consensus standards, and I guess you guys can see my cursor, right? Can you nod, Brian, if you see my cursor? Good. So ISO 3864 is kind of the world standard on coming up with graphical symbols for safety signs. And of course, these look familiar. This is the sign indicating a prohibition of something. This indicates that you're supposed to do something. So when you see something inside a blue circle, that's what that means. This is, of course, the usual caution sign, warning sign, and along with the sign indicating prohibition are probably the two best known of these signs, since they're also the most widely used. A safe condition, for example, just saying here's a staircase that you can use as an exit, that is put into a green square. And finally, fire equipment is designated, the location is designated with a red square. So if we're going to regulate cannabis and we're going to put something on the label to warn people about what is inside, or at least to indicate that they need to exercise caution, there really is only one choice here, and that is the equilateral triangle. And so what do we put inside it? Well, I'll give you three guesses. No, I'll only give you one guess, because there's really only one universally understood symbol. And this is very important. In standardized symbols, you are not allowed to use letters, numbers, punctuation marks, with a single exception, and that is the generic sign indicating attention for caution signs. When you see an exclamation point inside the yellow triangle, that is actually considered standard under ISO 3864. Every other warning sign that you create has to have a graphical symbol that represents what it is you're being warned about. And so there's nothing out there that says cannabis like the leaf. And so that's why we chose this. And I designed the leaf so that it is very reducible to small scales. And I say I, by the way, when you hear me say I, count my son in this one too. He's a graphic designer who actually has been helping me all along the way with this process, and actually showed me a few things on Adobe Illustrator and how to get some things done. So this wouldn't be possible without him, and he actually is our co-designer for the symbol. Most of it was, I'd say most of the ideas were mine, and one of them that we talked about extensively is how to make a symbol that can be reduced to very small sizes without turning into a blurry mess. And one thing to do is to have the confluence of all the leaflets have a lot of space in between. So if they do get grayed out, it still looks like a cannabis leaf at greatly reduced sizes. Here's the symbol itself on both a light and a dark background. And all of what you see here has been very carefully defined using the standards of ISO 3864. And there's also a color standard that was developed by ANSI. It's a Z535 for you geeks who want to go look it up. This yellow is called warning signal yellow, and it is the only official color to be used for warning signs. So this is all very well laid out before we ever put pen to paper, or I guess finger to touchpad. And here you see what the dimensions are. It's an equilateral triangle. Those dimensions that you see here are all defined by ISO, accepted worldwide, including by other organizations. So once one organization comes up with a good consensus standard, generally all the others will just tacitly adopt it unless there's a reason not to do so. So that's why we will it behooves ASTM and DFCR to work with existing ISO standards and ANSI standards. And in doing so, you can pretty much see everything defined here. The little red triangle inside the dark, inside the yellow triangle, the thin triangle shows the extent to which you can have the object sit. I tried to make it as big as possible. And also the object has to occupy no more than 50% of the field of yellow. And so you see that it's compliant in that respect too. We actually arbitrarily defined how wide the yellow border should be because there's actually no standard for that one thing. So here's how it would look. Well, here's how it does look. When you put it onto a vape pen, for example, if you say that you want all products labeled, that means every layer should have some regulatory standards governing it. So what you see on the left is a box, and that's the outer box that would appear in a store. Well, if there's a jar inside, that also will have some requirements as to what you see on that jar. And the cannabis symbol may be there too. It's really up to the authorities having jurisdiction to decide where and when to use the IICPS, the International Intoxicating Cannabinoid Product symbol. So when you hear IICPS, that's what we're referring to. So here's a comparison of the IICPS to all the other symbols currently in use. You can see it's quite the motley crew of different ideas. Just if you've been paying attention, you'll know that most of these are already out of compliance simply by having either letters or an exclamation point inside the symbol. This is anathema to international standards. And, presumably the state regulators could, there's no reason for them to necessarily know that going into this. It was with a lot of work between DFCR and ASTM that we worked it out that the only thing that would work is the cannabis leaf inside the triangle. You'll see that the symbol that comes closest to being compliant is from Maine and Massachusetts. They share a symbol. It's the only symbol other than the IICPS that's used in more than one state that's fully legalized. Some of the medically legal states you'll see are in light gray. The medical states tend to change their symbols, so I don't really quite count them as much as the fully legalized states. And what you see at the top is that, of course, ASTM now has assigned a number to the symbol. It's ASTM D8441. You can buy the standard online now from ASTM. Authorities having jurisdiction pretty much all need to buy that just to ensure that they're making, that they're keeping everybody's version of the symbol compliant. But it's as easy as downloading a PDF to get this symbol at this point. You can download it from the DFCR website, and that is dfcr.org/labeling, and you'll see it there. It's just the symbol itself. Now, it is perfectly fine for the symbol to show letters underneath. And here you can see we've got what Alaska has proposed. This is just very recent. They want to use THC and the initials for Alaska, AK. They got that from an early version in an article that I had published about what letters could go underneath, and that was their idea. Montana is the one state that's already got products to market bearing this symbol. And in their wisdom, the legislature there that had a lot of very unhappy people with the prospect of legalization, despite the overwhelming vote from the voters, they decided that they want the word marijuana underneath. Ostensibly, it's because more people will know what marijuana is than to know what cannabis is. Maybe still true, but that's kind of a weak argument. The unspoken argument is that it's more stigmatizing, and they actually want that. They want people to see it and to have second thoughts, because cannabis somehow sounds less hazardous and evil than marijuana in their minds. My home state of New Jersey just adopted the symbol by putting it inside a larger symbol along with the hands in a stop sign that is already used in some states to indicate lack of safety for kids. It's not a voluntary consensus standard, but it is being used. And there's studies to show that kids do recognize, that little kids who might not know the cannabis leaf will understand the hand in the stop sign at, say, 3 or 4 years old. That might actually stop them. So that's why they chose that. And then Vermont has chosen the symbol, but they want to do it in the style of Maine and Massachusetts. And pretty much everybody agreed that the Maine and Massachusetts leaf is actually kind of a maple leaf. It's not, it certainly doesn't fit the botanical description of a cannabis leaf. All right. And so if you look all the way on the right, you'll see another growing phenomenon. It started with Colorado deciding that a brand or a embossing or a direct printing of their symbol, not in red, but in black or in some contrasting color directly onto edibles or other cannabis products is important for indicating what one's serving is. And also telling people that this is not just an ordinary bar of chocolate. So I actually think that that's a great idea to have a symbol on the edible itself so that people don't make that mistake, and many people unfortunately have. You'll see that the IICPS is very well suited for this purpose. And if you reduce it to a very small size, it still looks like a cannabis leaf in a triangle. And it doesn't have the letters and the exclamation point and the little printing that would be very hard to reproduce at small sizes by embossing it onto, some food product that wouldn't really accept that much detail. I'm not going to say too much about the other symbols. I've already sort of espoused my point of view on why I think we should be using the IICPS. Before ASTM decided on the IICPS, they were going to go with Canada's symbol, which is the stop sign you see here. Of course, not compliant with voluntary consensus standards, but it is the only symbol to be used at a national level. So they were saying, they reasoned that Canada is the largest is the symbol used by the most people, but that's not true because California's symbol automatically is more widely used than Canada's because the population is larger. And as we add states with the IICPS, we are going to be passing Canada hopefully fairly soon. New York is looking at the symbol. Gosh, what other states are we talking to? Other states, other newly legalized states. And we're emphasizing states that haven't yet adopted a symbol rather than trying to convert states that already have their own. But in either case, whether it's a new state adopting a symbol or if it's a state wanting to change their symbol, the best thing to do is give a grace period so that manufacturers can go through existing inventory of packaging before they have to retool and use a new symbol or a new label of some kind. So I've already discussed that. Here's an article that came out in Cannabis Science and Technology where it's probably the most thorough discussion of the symbol, its use, and its rationale. And now I'd like to talk about product warnings. You're going to see it's funny that the simplest thing I gave the most time to, this I'm going to give a medium amount of time to. And when we get to the cannabis information label, because it's still so much in its infancy, I'm going to spend the least time on that. But if you guys are interested in any of these things, please certainly be in touch. So in creating a standard cannabis product warning, the optimal way to go is to have it be as comprehensive as is necessary, as is feasible. So you want as much information in there as possible, yet you want it to be as brief as possible because you want it to be large enough so that when it's printed on a package or in any other context, if it uses fewer words, people might actually read it. If it's a lot of fine print on a package, people will just ignore it and they're not going to remember what they saw if they happen to glance down. So we all remember the Surgeon General's warning on tobacco that was the first thing to come out, maybe hazardous to your health. That was a good start. Well, here we know a lot more about the health effects of cannabis, and insofar as there are at-risk groups related to cannabis, we need to notify them. We need to give them that caution. So here you see, we mention inadvertent ingestion by children and pets, talks about not driving if you are intoxicated. That's a controversial topic because there are people who are regular cannabis consumers whose driving is not measurably impaired. And actually the federal government and the FDA acknowledged that many years ago when they said on the package of Marinol or Dronabinol, which is just synthetic THC, that you shouldn't drive until you know its effect on you, which is a typically appropriate thing to say. But if you are a novice user, a naive user, and you consume a lot of it, it will definitely impair your driving. And so we need that warning there. We have to tell people that the product can be addictive. Some people on the free the weed side will dispute that, but I think Brian, being a longtime addictionologist, as well as I not being a specialist in addictions, but having treated people, understand that there is some risk of addiction. And then there are adults, well, there are children, and so we talk about under 21 should not make any non-medical use of cannabis, but use of the product can be harmful by several groups of adults. One is people who are inexperienced. They got to be careful with it because they can have a very unpleasant, non-lethal, but unpleasant experience if they overdo it in the beginning. Pregnant women, breastfeeding people, or at-risk individuals at risk with for psychiatric problems, particularly psychotic disorders. And we don't just say people with psychiatric problems, because it does seem to matter a lot whether somebody is predisposed to psychosis as to whether cannabis is likely to trigger or exacerbate it. And so we want that warning in there as well. I'm also proposing additional warnings for particular product forms for inhaled concentrates, since it's so easy to inhale them while getting a very large dose in a single inhalation. We recommend people to start low and go slow, which is a mantra in medical school that I think should be shared with the general public with a lot of drugs, cannabis included. Edibles and oral concentrates, because you can just swig them down and they can take up to 2 hours to kick in. If you exceed the serving size, you may end up like Maureen Dowd, as she wrote about, I think in the New York Times columnist, talking about her really unpleasant experience with an edible, I think in either Colorado or Nevada, how she just wound up curled up in the corner of her room waiting for it to be over, because I think she exceeded the dose by a factor of like 3 or 4 or something. So there's a cautionary tale, right? And also letting people know that you may have lingering effects up to 8 hours. So just know that if you're ingesting it. Topicals for external use only, and that's pretty standard. Interactions with other drugs. This is one I'm wondering. This is a warning for consideration, as you see. The ones before were particular product forms. Here are some others that I'd be very interested in people's feedback about. One is because of the cytochrome P450 interactions, you can get some interaction, but particularly with alcohol or other drugs, mix them and you get a much greater effect of intoxication. And that's particularly relevant to driving, because while cannabis by itself impairs driving much less than alcohol, alcohol is really much worse than just about any other drug. If you combine alcohol with any other drug, including cannabis, the impairment is far worse than alcohol alone. And so I think we should somehow convey that message to the public. And finally, we do know that it causes tachycardia, which could be an issue for people with underlying heart disease. But again, this is for consideration and I imagine debate. And that's a work in progress, so please do be in touch about that. The cannabis information label, I'm going to just spend a few minutes on. And here you see all the parts of it. You can see this online in an earlier article I wrote for Cannabis Science and Technology. It's about 10, 15 pages long, talking about nothing but what belongs in a good cannabis information label, starting with the basic information, which is that top box, followed by the content of cannabinoids, terpenes, and maybe flavonoids in the second box. The third box should have the standardized warnings. And the fourth box, which maybe could be placed elsewhere, should very clearly indicate the lot number and the expiration date. Something else I'm working on is a kind of serial number for each cannabis product that will be unique, that will tell you where it was made, nation and subordinate jurisdiction, as well as the date when it was made, and with a certain code, the manufacturer as well. You can see it should be, in my mind, almost the same for both medical and adult use products. Really, you just change the word dose to the word serving size, and there you have the conversion. But that way, people get used to reading one kind of label. And if you think this looks a lot like either supplement labels or nutrition facts labels, that is very deliberate. My original version of this was quite exotic looking with many colors. And my son just kept saying to me, "Dad, you have to make it look like everything else." And I'm thinking, well, but it could be copyrighted. It turns out that's not actually the biggest issue. But eventually I had to concede. And now, yes, this is the design that we're very familiar with and really should carry through on cannabis information labels. You can see the boxes can be rearranged. This shows what happens when you put it all together. ASTM is working on a consensus standards for all cannabis packaging, which includes the information label as well as the whole package itself and all the subordinate layers going down to the level of the product. And that is it. That was a lot of talking very fast. And I hope that was informative. I hope it was interesting. I certainly can geek out on it for hours. And if people have things, questions, I think now is the time.
Yeah,
Dr. Agnell.
please. We've got a small group here, so I think we can probably just handle it if people want to come off mute and ask a question. I've got a question to start us off. I was interested in the design of the flower with just the very small specifics of, the shape of the flower, and each leaf has those little jagged edges that look kind of leaf-like, but I'm sure there was some thought that went into the angle and
Yeah.
all that.
And what I did there, I'll take you back to it if people are okay with that. Hang on, let's go back to our original leaf. Okay, let's do it this way. Yes, so what I did was I took a bunch of photographs of cannabis leaves, averaged them out. I counted every notch that you see in the leaflets and kind of averaged the numbers. It was deliberately 7 leaflets, which is actually the most commonly used in other states as well. 7 seems to be a nice number. 5 really does look like maple leaf, because maple leaves have 5 leaves. And more than that, and it starts getting very complex to try to fit on something. So yeah, it was a lot of thought actually went into how exactly, oops, where are we going here? There we go. How exactly to lay out that leaf so that it occupies as much space as possible, is as large as possible within the space, and still be very clearly recognizable. Some people said don't use the notches because when you reduce it, it looks funny. Well, if that's really the case, that you're reducing it that far, then you need to work within the constraints of the resolution, and that will require to going back to the original ASTM standard and making sure you're just following all the rules that define this leaf. That leaf is completely defined in the ASTM standard, such that if you read the standard, you should be able to create the leaf from scratch. It won't maybe look exactly the same, but it should be very, very similar in just about every aspect in the way it's defined.
Thanks. Interesting.
Other questions?
Yeah, and I know David's looking really for feedback on the warning, what people think should be on a warning.
I can go back to that. Yeah, anybody think there's something there that shouldn't be, or something that isn't that should?
I wonder about the, wrote it down, at risk for psychiatric disorders. We're all at risk for a psychiatric disorder.
Yeah.
We've all got dreams, if we got exposed to severe trauma.
Right.
So it's so general that I don't have a better phrase.
Well, right. And I've struggled with literally every word, in some cases every letter of this boxed warning, trying to reduce it as much as possible. I could have said at risk for psychiatric problems. It could have been at risk for psychotic disorders. But that's not even broad enough, because I think it can have a deleterious effect on some people with mood disorders. Some people swear by it for mood and anxiety disorders, and God bless them, they should be allowed to use it. But I think we also need to let people know that it can have adverse effects in people either with or at risk for psychiatric problems. And I think to say just with psychiatric problems is tricky, because if you're a 17-year-old where you have 3 second-degree relatives with schizophrenia, you better think really hard about trying pot at a young age particularly, but really at any age.